Hi everyone, I'm Dr. Madhumita and welcome to my channel. Today I'm going to talk to you about a young lady. This story is one of the very important thing that I wanted to discuss to you all about. That is, it's about the need for young girls to take cervical cancer vaccine. Why? Because we had a young girl or lady who was just 25 years old. She came to us with a painful menstruation. She also complained of foul smelling discharge, and every time she was having a sexual relationship with her husband, she experienced some form of pain. Other than this, when we asked her, she said she just has a little bit of mental pressure because her husband has multiple partners. Otherwise, she's currently not on any medications. We examined her and we found that in per vaginal examination, there was some foul smelling discharge. We did a pap smear and we came to know that she was having early cervical cancer. She is a mother of three kids. The first one was born when she was 17 years of age. The second one was born when she was 19 years of age. And the third one was born when she was 23 years of age. This lady was very lucky because she was diagnosed in the early stage. So she could go back to her family after the treatment. She was cured of disease and she is leading a happy life with her family. But not every single person is as lucky as she is. Well, to know about this, you should know why is cervical cancer so important. Cervical cancer is the second common cancer in women, especially in young age it occurs in India. And it is also the second leading cause of death in women due to cancer. What are the risk factors for cervical cancer? Well, if you're someone who has multiple sex partners, it's not just about you who is having multiple partners, but even if your partner, that is your husband or whoever is your partner, has multiple partners, but you don't have, you're just in contact with that one particular person, you are definitely at risk. Or let's say that you had a early onset of sexual intercourse, definitely you're at risk. Let's say you have been having history of repeated sexually transmitted infection, then again you are at risk. People who have HIV, please be careful because you are at 5 times more risk for cervical cancer as compared to a normal person. If you're someone whose family member has cervical cancer, whether it's your mother or your sister, any first degree relative, then you have 2 times more risk. There is some genetic relationship with cervical cancer. How are we going to identify whether you have it? Well, clinically, in very early stages, you might be completely asymptomatic. You might not have any symptoms at all. As it progresses, you might have abnormal vaginal bleeding, you might have painful urination, you might be noticing blood in urine, you might be having difficulty in passing stool, or you might feel a little bit of heaviness. It can present in various ways. So that is the reason when we examine you also, you might be completely normal, or we might have some foul smelling discharge from your when we do the examination. So that is the reason we always go for a pap smear in every young lady. And if you are someone whom we are suspecting to have a cancer, then we definitely see where all it can involve. Let's say we are suspecting that it has gone forward, that is your urinary tract, then we might go for cystoscopy. We might be doing colposcopy to see properly inside your vagina. We might be going for a proctosigmoidoscopy if we are suspecting that it is involving your rectum, anal canal, your colon, and all. Depending on where we are suspecting, let's say we are thinking that it's an advanced disease, then we might even go for a PET scan, CT scan, MRI, etc., depending on your level of presentation. I have been repeatedly insisting you might be asymptomatic. We might not be finding anything in your per vaginal examination. That is where the pap smear comes to play. If you're a young woman who is above 21 years of age, between 21 to 29, we suggest that you get a routine pap smear done 3 years once at least. And if you're someone who is between 30 to 50 years of age, then please get your pap smear done 5 years once at least. The reason for suggesting this young population is because cervical cancer is mainly noted in young age. How are we going to prevent? This pap smear will help in early detection. How are we going to prevent it? When you have a tool in hand, why don't you use it? That is your cervical cancer vaccine. So cervical cancer vaccine is given to every young girl who has attained her menarche. That is, after her first periods, we suggest you to give the kids, your child, this vaccine. As a mother, we have been seeing so many ads about cervical cancer. There is one particular ad that caught my attention where the mother is thinking about her daughter's wedding and what all gifts she has given. In that, she would be thinking about the cervical cancer vaccine as well. It is that important. Rather than the gold jewelry and the tons and tons of clothes and the money that you give, it is the health that matters a lot. So kindly give your child cervical cancer vaccine. Talk to your physician. We have 2-3 types of cervical cancer vaccines. Each of them have their own pros and cons. Based on your child's profile, we will be giving the vaccine. So every young girl needs this vaccine. And of course, as a mother or as a parent, it is your responsibility to tell your child about the various protections that is involved when it comes to sexual intercourse. It is never too early to know about preventive measures. If you find it to be extremely difficult, there are certain educational videos about it. Kindly let the child watch it. And if even for your case, it is better to have a protected intercourse as much as possible. Now, coming to the treatment part of cervical cancer, we do have a lot of options, laser ablation being the earliest one. We do have surgery. It can be a minimal invasive surgery to a hysterectomy with oophorectomy and involving dissection of lymph nodes, depending on your staging. We do have other options like radiotherapy, chemotherapy, depending on your staging. When it can be prevented, why do we have to worry about treatment? But if you're someone who already has a cervical cancer, kindly don't worry. We are with you. We will fight the disease together. I'll be meeting you all with more informative videos like this. Good day.